Hey everyone, I'm really glad you made some time to join me today. I want to start with something most people don't realize until the very last moment. We're now entering the final days of Medicare open enrollment, and this is the time when people either breathe a sigh of relief because they handled everything early, or they suddenly feel that tight knot of worry because they waited. And now the deadline is staring them right in the face. And honestly, these final days matter far more than people think. A tiny change inside your plan, a premium bump, a medication dropped, a doctor removed from network, can affect your entire year ahead. Even a letter that looked like junk mail can impact your Social Security check or your prescription costs. You'd be surprised how many messages I get from people who say, "I wish I knew earlier. That's why I want you to stick with me today." What you learn in the next few minutes can protect your wallet, your coverage, and your peace of mind. There's also a very common mistake people make during this exact time of year, and I'll explain that a little later. But first, let me ask you something. And everyone watching can answer this. What part of Medicare feels the most confusing for you? Is it the plans, the drug lists, the paperwork, or just understanding changes? Let me know in the comments, because you're not alone. Millions feel the same way. Now, let's walk through what's actually happening right now, because this is the moment when people usually snap back into focus. The deadline is close enough that it's real, but there is still enough time to make a smart, confident decision. And honestly, this final stretch is when most people uncover something inside their plan they didn't notice before, something that does matter. So if you've waited until now, don't panic. You're not late. You're exactly where most people end up, as long as you take a few minutes today. Here's the truth. Medicare looks different this year. Costs are shifting. Plans are restructuring. Certain medications are disappearing from formularies. And in many areas, companies are ending old plans and moving people into new ones without them fully understanding what's happening. And that's usually when someone reaches out to me in January asking, "Why did my payment jump?" Or "Why am I suddenly in a different plan?" This, right now, is the moment you catch those surprises. One of the biggest changes affecting people this year is the rising cost of Part B. It's going up again, and a lot of people are frustrated because their Social Security increase just doesn't keep pace. The Part B premium is climbing and the deductible is increasing too. So while Social Security is going up by a small percentage, Medicare is taking a bigger bite out of the check. Now let's talk about something affecting nearly everyone: prescription drug plans. All across the country, the number of standalone drug plans is shrinking. Companies are merging or shifting coverage, formularies are changing, and medications that have been covered for years are suddenly being removed. This is the time of year when people find out, sometimes accidentally, that the drug they rely on isn't covered anymore, or the zero premium plan they loved has disappeared. That $0 plan can suddenly cost $25, $40, even $90 a month, depending on where you live. And while the national average might look stable, most seniors will pay more because their specific plans were changed or discontinued. And there's something else that's catching people off guard. Some very common, very important medications won't appear on certain formularies next year. People who depend on them are being told they must switch to alternatives or biosimilars. That's not something you want to discover in January when standing at the pharmacy counter. This is when you check it. But here's where many people run into trouble. They toss the annual notice of changes in the trash. I understand. The envelope looks like junk mail. But inside that letter is every single change happening to your plan, your copays, your deductible, your formulary, your premiums. One person shared a story about ignoring that letter and getting moved into a plan costing nearly $100 more per month, all because they didn't look. And that brings me to auto-enrollment. If your plan is ending, Medicare can automatically place you into another plan from the same company, but similar doesn't mean identical. You might get fewer covered medications, higher drug tiers, or a much higher premium, and since it's automatic, people don't realize it until after the holidays. Another challenge this time of year is that people feel overwhelmed and don't know where to start. Only a small fraction of Medicare beneficiaries actually compare plans online, and even fewer use the free counseling available to them. A lot of people don't even know these resources exist. And that's unfortunate, because reviewing your plan, especially now, can save you hundreds or even thousands of dollars. Now let's talk about Medicare Advantage, because this is where many people get confused. Medicare Advantage can offer extra benefits: dental, vision, hearing, even gym memberships, but you still pay your Part B premium. You may have co-pays, you may need referrals or prior authorization, and you may be locked into certain doctors or hospitals. Some plans have out-of-pocket maximums that can reach thousands of dollars, something that surprises people who thought a zero premium plan meant zero costs. And I want to address something extremely important. If you're thinking about switching from Medicare Advantage back to original Medicare and buying a Medigap policy, this is where people often hit barriers. Outside your first enrollment window, Medigap companies can deny you or charge more based on your health. That's why some experts call it a lock-in. But here's a small silver lining. If your Medicare Advantage plan is being discontinued, you may qualify for a special enrollment right that lets you get Medigap without medical underwriting. If that applies to you, this is the time to use it. Now, another major theme this year revolves around efforts to lower healthcare costs. A newer program allows people to spread their prescription costs across the year instead of paying large amounts up front. It's incredibly helpful, but here's the catch. You must enroll yourself. It doesn't happen automatically, and during this rushed time of year, people forget to do it. There are also more options expanding for people with chronic illnesses or those who qualify for both Medicare and Medicaid. These plans can offer tailored support, but again, they require comparing details, and that takes a bit of time. One of the biggest questions I hear right now is, do I really need to check my plan if I like it? And the answer is absolutely yes. Because the plan you like today might not be the plan you have on January 1st. Your medication could move to a different tier. Your pharmacy might no longer be preferred. Your deductible could increase. Your premium could change. And if you don't verify these things now, you're locked in for all of next year. The easiest way to review your plan is through the official Medicare website. Type in your medications, your pharmacy, and your zip code, and it shows every plan available in your area and what your costs will look like next year. It takes just a few minutes and can save you a lot of stress later. If websites aren't your thing, or if you'd rather talk to someone, there are free programs where trained counselors walk you through everything step by step. No pressure, no commissions, just guidance. Keep in mind, this is the busiest week of the entire season. Websites slow down, phone lines get crowded, brokers get overwhelmed. So the earlier you review your options, the less rushed you'll feel. At the end of the day, Medicare isn't just paperwork or fine print. It's your doctor visits, your medications, your ability to get care when you need it, and your peace of mind. With so many rapid changes this time of year, it's perfectly normal to feel overwhelmed, but you're not alone. A lot of people wait until the end, and that's okay. What matters is that you take a little time now to make sure you're set for the coming year. So let me leave you with this. A quick review today can protect you from big surprises in January. Even 10 minutes can make a meaningful difference, and your future self, the one who needs a refill in February or a checkup in March, will be glad you did. Thank you for being here today. I appreciate you spending this time with me, and I hope you feel more confident going into the deadline. Take care, and I'll see you soon.